I am Dr. K.S. Nayak, the Chief Nephrologist and Head Department of Nephrology and Transplant Services at Deccan Hospital High Nephrology. Nephrology is, in short, treatment of any disease related to the kidney. To begin with, I would like to talk about kidney transplantation. Kidney transplantation is performed when a person's both kidneys have failed terminally and are on dialysis. Once they are on dialysis, if they have a family member willing to donate, then after doing a number of tests, making sure that the donor does not get any problems subsequent to donating the kidney, we go ahead with the transplantation. Donating the kidney is not harmful to a person provided we make sure that the donor, the kidney donor, the family member undergoes a battery of tests and comes out with all reports normal. We have in fact performed more than 1,000 transplants and not even a single donor has had a problem after donating the kidney. Those who do not have a donor in the family can go for what is called a cadaver kidney transplant. In this cadaver kidney transplant, they come to us and we thoroughly analyze them, and then we put them on the computer with their basic characteristics, starting with the blood group and their other details, so that we can give them a priority list, and then they are put on the waiting list and kept on dialysis, which is either hemodialysis or peritoneal dialysis. And when a cadaver organ is available, which is a cadaver organ comes from a person who is a cadaver, and a cadaver by definition is a person whose brain is dead. The brain death can happen because of a road traffic accident or because of medical problems such as severe bleeding in the brain, and the neurologist certified that the person's brain is dead. Subsequent to that, after doing again a number of tests, the neurologist or the neurosurgeon certifies that the patient is no more because the brain is dead, and then the organs can be donated, which is then donated to people with end-stage kidney disease or end-stage liver disease or end-stage lung disease or end-stage heart disease. Actually, a person who is dead can make a difference to the lives of 28 patients, out of which some of them their lives will be saved because of this, especially those with the heart, kidney and liver and lung diseases. But they can donate organs and tissues to 28 different people. So it is a very noble cause that in death you do the sacrifice and save the lives of people who otherwise would die. So transplantation basically is done either from a close family member or from a cadaver donor. For those who do not have a donor, if they have a very close donor like a proven uncle or a aunt, then with all the certification, they have to go to the authorization committee, which will scrutinize the papers, make sure that the papers are genuine, and then only come and then they come with the permission for transplant, and then they undergo transplant. But I would strongly recommend that if there is a family member, they should go ahead with the family donor. We have performed more than 1,000 transplants, especially we specialize in complicated kidney transplants where patients may have multiple problems. To tell you a fact, more than 60% of our patients have diabetic kidney disease and also have heart problems along with kidney problems. Those who have liver problems, we have done kidney transplants in them. So we specialize in high-risk transplants where we are able to get excellent results after taking the necessary precautions. In the area of transplantation, we have done some of the most outstanding work anywhere in the world. To give you an example, our team performed the first simultaneous heart and kidney transplantation The heart and the kidney came from the same brain dead person, the cadaver person. So the dead person's one kidney and a heart was transplanted into one of our patients. So this was the first such surgery performed in the country. We have also done a number of sequential liver and kidney transplant, which is again a person receives a liver transplant, and then subsequently after some time, because of certain other problems like diabetes continuing or certain other problems, they develop a kidney problem. So a second transplant is done with a kidney transplant. So it's called a sequential liver and kidney transplant. In fact, one of the unusual transplants that was done was a lady donated her liver, left lobe of the liver. A living person can donate a liver. The left lobe of the liver was donated to her husband. The husband, after 4 years, developed kidney failure, and the same lady, his wife, donated one of her kidneys to this person. This is a very unusual case of sequential liver and kidney transplant. We also did, for the first time in the world, a special procedure called percutaneous transluminal renal transplant angioplasty, which means just like people can develop a block in the heart vessels, a person can develop a block in the kidney that is transplanted. So when that is done, you can do exactly a similar procedure, but it is much more complicated. And for the first time in the world in 1995, we did this procedure successfully, where we removed the block and put a stent into that person's transplanted kidney. And this was, as I said, the first time successfully done in the world.